Welcome to our videos about diabetes treatments in Hindi. If you are looking for the right diabetes treatment in Hindi, then you have come to the right place. This article discusses Ayurvedic medicine, tests to measure blood glucose levels, and the symptoms of diabetes. Hopefully, you can benefit from reading it as much as I did. And remember to share it with your family and friends. We hope this article has helped you understand diabetes better. Here's a list of helpful hints. Ayurvedic medicine. Ayurvedic medicine for diabetes treatment is a way to prevent or manage the condition. Diabetes is the most common form of diabetes and can be treated with various Ayurvedic remedies. Some examples of these medicines are paneer, phool, and guggulu. Learn about the best ways to take these Ayurvedic medicines to manage your diabetes. Here's a brief guide. In Ayurvedic medicine, diabetes is a disorder caused by imbalances in Doshas. An excess of Kapha can cause the disease. Other causes of this disorder include obesity and too much sugar. A weak pancreas is also linked to diabetes. Vata is another contributor to diabetes, as excess Vata builds up in the large intestine. It travels to the pancreas, resulting in a distorted balance of Vata. Ayurvedic physicians may prescribe a specific diet to treat diabetes. In addition to limiting carbohydrates, diabetics should also practice yoga and avoid sugary and processed foods. Ayurvedic doctors also recommend reducing stress, as this can aggravate blood sugar. While exercising and doing yoga can help control blood sugar, it's also important to avoid eating too much and too soon. Diabetes Ayurvedic medicine may be the answer you've been searching for. Diabetes is a major problem in the United States. Healthcare costs associated with this condition are astronomical, and the number of people living with diabetes is increasing. While the disease affects millions of people, Ayurvedic medicine can be very effective for both patients and their families. And since it is a holistic approach to health, it can benefit many more people than just diabetic patients. So, make sure to look into Ayurvedic medicine for diabetes treatment in Hindi. One of the main causes of diabetes is a poor diet. Most Western diets are heavy on dairy products, alcohol, and fat. Additionally, a poor diet can lead to other complications, such as obesity and stress. Some of the other causes of diabetes include heredity and excessive sleep. If these conditions are present, Ayurvedic medicine can help you manage and even prevent diabetes altogether. And while Ayurvedic medicine can be a good option, it can't cure all of your diabetes problems. Tests to determine blood glucose levels. Whether you have been diagnosed with diabetes or you're just curious about how to monitor it at home, testing your blood glucose level is a critical part of managing diabetes. This condition increases your risk for a variety of serious health problems, including heart disease. During your visits to your doctor, your physician may ask you to monitor your blood glucose levels at home, in order to help your physician determine how well you're controlling your diabetes. A1C tests measure the average blood sugar levels for the past 2 or 3 months and give your doctor a good idea of whether you're on the right track. Elevated levels may require a change in insulin, medication, or meal plans. While your doctor will decide what your target level is based on your age and other medical conditions, it's recommended that you aim for A1C levels that are less than 7%. The first of these tests is the fasting glucose tolerance test. The test involves fasting overnight and drinking 75 grams of glucose in the morning. A blood sample is taken 2 hours later. If your blood sugar levels are over 126 mg/dl, you probably have diabetes. In the case of prediabetes, the level is in the 140 to 199 range. Once the levels are lower, your doctor may prescribe medications that will reduce the risk of developing complications, including heart disease. The most common tests for diabetes treatment are the fasting plasma glucose test, FPG, and the A1C test. Both tests measure the blood sugar levels in one or more blood samples at a given point in time, usually in the morning. In addition, both blood glucose tests require you to fast for 8 hours for a proper blood glucose reading. In some cases, a fasting blood glucose test can be conducted without food and can be performed at any time of the day. Other types of glucose testing can be used to diagnose diabetes. In the case of gestational diabetes, the glucose tolerance test is often performed during the first few weeks of pregnancy. This test is usually performed in women between the 24th and 28th week of pregnancy, or earlier if they have a history of gestational diabetes. A diet plan containing low-calorie foods, increased physical activity, and medications are often used to manage diabetes in pregnant women. Symptoms of diabetes. Besides the signs and symptoms of diabetes, a person with this disease may also experience frequent urination, dry mouth, and itchy skin. These symptoms are caused by the body's need for more sugar than it receives from food. High blood sugar can also damage nerves and affect the flow of blood, affecting the healing process. If you notice these symptoms, it is time to consult a doctor. Further, a person with diabetes may also experience yeast infections, as yeast feeds on glucose in the blood. High blood sugar is the most common sign of diabetes, so the first step is to determine the cause. If the sugar levels are too high, your body may not produce enough insulin to regulate the blood sugar level. This can lead to serious complications such as kidney failure and blindness. Symptoms of diabetes may be gradual or can develop gradually. Diabetic patients may experience symptoms such as frequent urination, increased thirst, and itchy skin. Type 1 diabetes symptoms develop rapidly in children and young adults but take longer to appear in adults. This autoimmune disease causes the pancreas to stop producing insulin, which enables the body to utilize food. Patients with this condition may experience weight loss and even dehydration. Diabetes may also lead to diabetic ketoacidosis, a dangerous condition that requires immediate medical attention. Further, type 1 diabetes patients must take insulin daily. Type 2 diabetes symptoms may be more subtle, but these symptoms develop slowly over years. While type 1 diabetes symptoms can occur suddenly, the symptoms of type 2 diabetes may develop gradually and you may not experience them at all. The more you wait, the higher your blood glucose levels will rise and become more severe. By then, you'll be battling high sugar and insulin levels for at least 10 years. You can still have some signs and symptoms of type 2 diabetes, but don't wait for them to appear. Another symptom of diabetes is blurred vision. As blood sugar levels rise, fluid is pulled out of cells to dilute glucose in the blood. This fluid then deposits on the retina, resulting in blurred vision. Ultimately, diabetes can cause severe damage to the retina, which can lead to permanent vision loss. Diabetics should have a dilated eye exam to detect any problems early. Diabetic retinopathy can damage the blood vessels in the retina, resulting in permanent damage. Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.